injuries. We're live, supposedly.
Live?
Yeah.
Oh, yeah.
Check connection with LinkedIn, or not LinkedIn, but Instagram as well. Supposedly we're live as well. Gotta reverse this. That would be the smart thing to do, right? Yeah, you might want to closer. We'll just pretend like we like one another. Hey guys, so let me put it against the water bottle. How about that?
That would be really good.
We have 2 cameras going right now, guys, so bear with us here. I'm Jen, Shift Human Performance here, and we're here with Dr. Zach Harmon. You can come in a little bit more. Yeah, there we go. I know, we have like 2 cameras going. This is our first time doing this. We're also live streaming on YouTube as well. But I wanted to have DPT, I guess it's kind of redundant, Dr. Zach Harmon join me today, just so we can have a chance to talk about the importance and why an athlete or even a sedentary individual who's having some aches and pains, things like that, or has an injury, would want to see or seek help with a PT, all right? And just to let you know, for all of you guys watching, I have given like full clearance to talk about any injuries that I've had recently, because Zach has actually treated me for a couple of different injuries this year. They're kind of fluky injuries. I'm not usually injured, so this has been kind of an eventful year. I wanted to bring in 40, I guess, with a bang. But yeah, so first things first, let's introduce ourselves. So Zach, tell us a little bit about you.
Yeah, so my name is Zach Harmon. I'm a physical therapist in the Denver metro area. I have a couple different locations. My model's a little different. I'm not at your normal clinic setting, so I service actually gyms, CrossFit gyms particularly. Sometimes I'll do other gyms as well. Compass Fitness is another one I've done. But I service CrossFit Verve, CrossFit Method, CrossFit Watchtower, and CrossFit Deco. And then I have a couple other gyms that another part-time PT works out of the gym as well. What's nice about that is we don't have to see people as frequently, which is nice. And we can communicate through the coaches to modify and get these athletes moving a little bit better in the class. So it's been an enjoyable ride, because I remember coming out of PT school, everyone would tell me that there's no way people would not use their insurance directly, and there's no way this would work. You don't have like your normal setup with the high-low tables and all this other stuff. You're going to have like a massage table that you fold up and down. They're like, it's not going to work, right? Everyone told me it's not going to work. But behold, I went through normal clinics, and I hated that. And so it made me kind of go through the motions of creating this.
You were really passionate. I mean, for those of you who don't know Dr. Harmon, he's a power lifter himself. But you're not just a power lifter, because I've seen you get up on the rings, and I've seen you do some gymnastics and things like that. So he's kind of the best of both worlds, strong and supple. But I'm curious, what got you into PT? Was there any type of inspiration?
Yeah, so my dad owned and operated a gym. I grew up in a gym. I was literally like, this room we're in is similar to where I grew up. And then we'd hear the music. So my dad owned and operated a gym in Fort Collins, Colorado. He did that for almost 16 years. And so that was from when I was little to end of high school, pretty much. And I even did some of it as an undergrad training outside of that gym too. So I got first exposed to fitness that way. And then my uncles, one of my uncles is a chiro. And so I learned a lot from him, just about the body and other things. And then I ended up meeting my dad just in PT school, and then they teamed up and they kind of worked together in a collaborative approach. And I was like, this can work. Like, this is a good relationship as long as people are on the same page. And so I was like, you know what? I want to go back and become a PT, because I love exercise, but I wanted to know more. Yeah. And so that's kind of what got me exposed. And then what got me into CrossFit and the powerlifting stuff is really Dan Pope.
Yeah, that's right.
I was into training, but nothing like to the level that I saw when I saw Dan Pope. I was like, I want to be that dude. Like, he's freaking strong, and then he also is very actually good at gymnastics as well. Yeah. And so I got exposed to PT because he's my clinical instructor on my last rotation, and then I was doing CrossFit with him off and on, sometimes out of his garage. Before we go into the clinic.
That's awesome.
So it was that's how I got exposed, and that's how it kind of diverted into this path where I wanted to be a PT in gyms.
Awesome. And for those of you guys who aren't really familiar with CrossFit Verve, which is where we are right now here in Denver, Colorado, I'm a part-time coach here. with CrossFit. You know, he's here at least twice a week just because he has a pretty large clientele base here.
Yeah.
We keep him busy. But Dan Pope was actually our resident DPT a couple years ago before he went off to Cambridge or Boston. Boston.
Yeah.
And now he's at as a champion, right?
Therapy,
Champion PT, which is one of the best PT clinics, you know, really in the nation. And Dan was our go-to guy. And then when we learned Dan was leaving, we were so bummed. But then we found out Zach was replacing him, and we knew Zach was learning under Dan, so that was great. And it's really because of their philosophy. You know, their philosophy is unique, kind of like what Zach hinted on earlier. You don't want to see us 5 times a week, or not even, that's an exaggeration, you know, twice a week or even like that, anything like that. You want to empower us to, you know, get our stability, get the movement patterns down that we need for longevity in our sport of choice, whether that's CrossFit. For me, it's mountain biking and CrossFit, lifting, things like that. You know, you're mindful about that, which is what we love so much. And so speaking of injuries, what types of injuries do you treat most often? What do you think?
So most common definitely is either shoulder or low back, but probably shoulder would be the first thing I see the most of. And a lot of the reason for that is the amount of volume you do overhead in Olympic weightlifting or CrossFit, and then it's a very mobile joint just by nature. And so a lot of people end up stretching a lot, right? They'll do a lot of mobility work for the shoulder, but in all reality, a lot of the times, in order to get the shoulder to feel strong and not as painful, we have to do a lot more strengthening with that stuff too. So I often see that get injured more because I think a lot of the times it's got so much range of motion. So you better be strong and you better be able to go overhead for high volume. If you can't, you're going to definitely do some compensatory strategies when you get tired. And that's where I see injuries.
Yeah, I can see that. Stability is so key. You know, like mobility is great. Of course, this is coming from someone who has hypermobile shoulders, but stability is really the game changer, I feel like, you know, and I know you see it with your patients. I definitely see it with my clients.
Yes.
Makes a huge difference. So what's your favorite injury to treat and why?
So favorite injury to treat is either low back or neck, actually. More complex versions of it, actually. So like, you know, you'll have different types of low back injuries where it hurts to either flex the spine or extend the spine. They'll usually have a directional preference to avoiding pain and what provokes their pain. But I actually enjoy some of these more complex ones where it actually kind of hurts both ways. Axial loading hurts. I mean, compression with the bar on their back hurts. And so I have to get kind of creative on what I can do to kind of calm their pain down and then start to build them back up. It's definitely interesting. So I enjoy a challenge in that aspect because I find that I have to constantly read up on something and then constantly do this. And it kind of makes, I know I'm growing then. So I enjoy that aspect of when I get a more complex patient.
Awesome. And just so you know, like Zach and I, sometimes we get lost in time when we're here in the gym and he has a break in between patients and I'm in a break, you know, maybe working out. We'll just start nerding out over stuff.
Yeah.
And, you know, and I don't read a ton of, I read plenty of scientific literature, don't get me wrong, just because of my research background, but I don't read a lot of it. But Zach, definitely, you spend at least an hour a day. Right?
I do. Legitimately, an hour a day. I've set up Instagram and Facebook. I have separate accounts to make it productive, right?
Yeah.
So I literally only friended fitness professionals, medical professionals. And so every time I get on there, they make my life a shortcut. So I'll be like, oh, there's an abstract. Is that worth reading? What did they say? Yes. Okay, cool. I'm going to go get on ResearchGate or something else and get the free copy. And then I'm going to actually dissect it. So I try to do that 1 hour. So it's been good.
It keeps you fresh, you know, things like that. I think that sometimes practitioners tend to stay as up to date, no matter what CEUs and things like that you need to get.
Yes.
So I want you to take a minute to explain your approach to diagnosing and assessing your patients, and you know, how do you treat them? This is when I would really love for you to talk about like discussing your payment structure because it is different.
Yeah.
Because you don't necessarily take insurance.
Yeah, not directly.
Yeah, not directly.
I'm not out of network provider.
Yeah.
So with the out of network provider, all that means is like you always pay us directly for the service, right? So now certain plans will reimburse you for what you pay me. So if you get 60% of the cost of that visit covered, I give you a certain receipt with the codes, and you can submit that to get reimbursed. Or it can count towards your deductible depending on how large your deductible is. And then you also can use HSAs or FSA accounts with us. So pre-tax dollars essentially. But we're not in network. what that allows us to do, the reason why I'm out of network, I used to be in network clinics. The reason why is there's two reasons. One, I don't want to be dictated by insurance companies on what I can or cannot do for my patients. So I had to get real creative sometimes to look at someone's snatch in the clinic, because it's not considered an activity of daily living, right?
That's true.
It's not functional based on what their criteria is. And a lot of the times, some of these athletes who are a little bit higher level compared to your normal sedentary person, which I enjoyed working with, they would get kind of frustrated with that, because we're typically just supposed to focus on their shoulder, right? If they come in, but I know they have other injuries or other things that are limiting them, technically I don't write that down on my note for reimbursement, because if I do, I can get in trouble, right? So there was some issues with that, where you had to kind of get narrow in your focus. So like someone came with shoulder pain, but maybe their neck is also involved, or maybe their ankle's involved with their squat, right? And their low back hurts. I was never allowed to really dive hard into those injuries that could be contributing to the original injury they came in for anyways. So it was really I was not able to be holistic, and I wasn't able to really dive into the source of their problem. You can get around that a little bit in network and kind of do it, but it was way more challenging. So I got pretty fed up with that part of it. The other part is reimbursement is always getting lower for in-network providers. And so when you get a lot of pressure to see more people in a short period of time, and so when that starts to happen, your quality inevitably will go down. Because you're going to start seeing, I remember I was seeing 22, 24 sometimes in a day. And so it'd be back to back, or sometimes I'd be double booked on a half hour, right? And so I'd have a tech, and I would basically just do manual therapy, try to help their pain, because that's what, sells. That's what the clinic director is going to be pushing us for. And then they would do the exercise that I prescribed with the tech. And as you know, position matters, right?
Oh, yeah.
While you're doing the exercise. So the tech doesn't know what to look for like I do. And so tech, you try to train your techs to do a good job, but inevitably it doesn't always work that way. And you sometimes would come up short for these patients, and you could have maybe gotten better without surgery or injections. And so the real goal was, I was tired of that. So I wanted to get on a mission that I could do whatever the patient needed to get them better, trying to avoid injection, surgery, or medications. And that was kind of the goal, was like, I want to work for patients, not insurance companies.
Yeah, and I love that, because I know that's the biggest thing. I'll get a lot of friends and fellow athletes here at the gym that'll ask, do you know a PT that takes insurance? My first response is, well, what's the issue, first of all? What are the symptoms? Not that I'm trying to diagnose or anything like that, but because obviously that's out of my scope of practice. But just get an idea of where they're coming from. And then given that, I always recommend them to Zach, just because the price point might be a turnoff at first. But the thing is when you look at the copays and things like that you will spend at every single visit for a traditional PT that is in clinic, it can actually add up to be more expensive than what you would actually spend for Zach's services or his business partner services. So it's kind of one of those things where you have to look at the end result and kind of the end game, and especially get in to see him and look at the prognosis, and then he'll be able to give you kind of an idea of what you're dealing with, and whether imaging and things like that are suggested, and kind of what's the game plan going forward. And I know for me, as well as other individuals that I've sent to you, like they've had the same experience, with a couple of people actually avoiding surgery altogether, including myself. I didn't really want to go under the knife, right away for whatever, issues I've had in the past year, because it wasn't really necessary at first. So
remember, you're gonna have to do rehab anyways after surgery. So it's like, why not give it a shot?
Yeah. Anytime you can just avoid surgery, if it's not 100% necessary, that's gonna be optimal, obviously. And I know with Zach's approach, and this is one thing I do love about his approach, is he does try to get his athletes under load, under some sort of weight, or back to the sport that's their sport, whether that's biking, cycling, CrossFit, things like that. And can you just kind of explain like why?
Yeah, and I think that's actually the best thing to bring up is a big difference that I see, and that was getting frustrated, was typically we're, in a traditional clinic, we would be told to tell the patients to kind of cease all activity that was contributing to the issue. That was the traditional way I was taught. And I would actually say, you need to do the opposite. And the reason for that is two reasons. One's from a clinician's standpoint, it actually makes us have a little bit more feedback to know if our stuff is working, right? So if you don't take the stressor out completely, and you try to maintain either a modification of the same exercise or a different rep scheme or load scheme to that exercise. Then we can get an idea of, okay, we dampen down a little bit of stress. We're doing these rehab exercises. We're doing some manual therapy. Is this working? Is it changing their movement output, right? The goal is to look at their movement, see if it's getting better, and see if the pain follows. So if I take out the entire stress of the system completely, right? No more load, no more squatting, no more mountain biking, whatever it is, right? Now they're automatically going to feel better. Their symptoms are going to get better. They're going to feel better. So it actually gives us less info to know if we're doing a good job, because they could go right back, and it could go right back to square one, and potentially they might become a chronic rehabber, because then they go right back, they get hurt. Now it's getting in their head a little bit. They're like, oh no, like again, right? Again. And so it kind of builds that. The more that happens, the less confident they become in their body. And that's just natural. That's just what any human will do. If you get hurt repetitively, you're like, whoa, I don't know if I want to do that again, right? And so that if you let that happen over and over, which sometimes happens when you take the stressor out completely, you make them feel good, and then you do that for 6 weeks and you say, okay, now you're cleared, right? They go right back to the activity, they get hurt again. And when that happens, I think it often actually does a detriment to the patient outcome. And that's why I don't, honestly, I was looking back at it, I was like, I don't think I've ever, if I ever get to the point where I tell you to stop everything, we probably are talking about surgery anyways. Yeah. Right? So most of the time I've always kept in some form of movement that's loaded based on your sport.
That makes sense. I know I was back biking like within a week or two. Once you had me realize that, I can put my shoulder or my arm above. I just had to like loosen up the musculature around the shoulder. So, and that definitely made me feel a lot more empowered, just knowing that I could go outside, pedal around, even if it was kind of like a quote unquote easier trail and things like that. It just gets your endorphins going. It makes you happier, makes you a happier individual in general. So that's always nice. But so we talked about injury. Now, how do you suggest athletes prevent injury for the most part? And I know it's kind of a broad question.
Yeah.
But obviously we can talk about mobility and stability, kind of what we hinted at earlier.
Yeah. So prevention, that word is a little misnomer, similar to stability, right? Stability is a bit of like, if we were to be in the clinician world or the literature world, they would say stability is like not a very good term to describe what we're talking about with strength. They would want us to say motor control and some other things. For some of the listeners who want to know the difference on that, you could look that up and see. With prevention, technically, screens and all this stuff we can't prevent injury, right? It's impossible to prevent it entirely. Accidents happen, all things, but we can lower risk. So when we talk about risk management, that would be the best way to start about talking about prevention. Risk management comes in a variety of things. We know the biggest predictor of injury is a previous injury. So how do we not allow an injury to happen? Well, we got to lower our risk completely. So this is where she can come in. This is where I can come in. Yeah. This is where psychologists can come in. This is where good coaching can come in. You need to do. Just don't do it. But this is where you want to maximize all your recovery pieces, and then you also that way you can train harder, so you can stress the system but recover well. And so I would say that strength is the best way we know to reduce risk of injury in whatever sport. So it's a very, very to control that tibia going forward when they land, which is those shin bone front. And that's going to be really important for runners, right? For CrossFitters, it's going to be shoulders. It's shoulders, rotator cuff, gap muscle. And then the other thing would be, okay, do we know where are they going to be with squats? They're squat strong. Are they able to do strict foundational movement before they do kind of kipping? You want to make sure the system is very strong before we start doing kind of volume on top of that. That's how we would reduce risk. I would say strength would be the number one way to reduce or prevent prior to doing the actual movement that you're trying to do. And remember all different types of movements. Yeah. If you only move fast, you should probably move slow. If you only move heavy loads, you should probably move light loads under slow speeds. Then you should move light loads under fast speeds. Like unfortunately, it kind of all matters if you want to be as resilient as possible, right? And for a CrossFitter, if I was cross-training a CrossFitter, I would tell them to move out of sagittal plane, right? Sagittal plane is more forward and back. I'd put them in the transverse plane, which is rotational, and I'd put them in more frontal plane. And that would tell them to go really, really slow. And I do a lot of single leg work, single arm work. And that would help them a lot because typically they're in bilateral movements and they're going super fast. So that's where I would start with. I would look at your sport, see what you're doing a lot of, and then how do I kind of put other things in there to give me some movement variability options so I'm more resilient to forces that come my way.
Yeah, and that's the key word here is resilience. I feel like if we were to maybe not focus on like prevention so much, kind of like Zach mentioned earlier, but think about how you can make yourself as resilient as you possibly can as an athlete in your specific sport. That's what's really going to pay dividends, you know? And this is where, you know, it helps to have a solid warm up and a solid cool down. And I mean, I hate to say it because I know a lot of athletes.
Nutrition's important, and sleep.
Nutrition. Oh man, recovery. All my clients know how important sleep is. You know, I actually put sleep kind of at the base of the pyramid for my health coaching clients and things like that.
As it should be.
Sleep and recovery, yeah. And then definitely nutrition. Not to say that nutrition does not play a role. It just maybe it plays a huge role. But I would actually put sleep and recovery because that's where your growth is being made. You know, that's where your gains are being made from all those squats and things like that. So yeah, don't neglect your sleep. That's if you were to get something from that, and that's a whole other Instagram live that, you know, obviously we can do.
As you would say, I've heard you say this before. More is not more.
Yeah.
Or sometimes less is more, right? So you can't exercise is still a stress. So I think people view exercise sometimes as a recovery agent because it distracts them from their bad stress in life.
Oh, totally.
But that's still stress. So it's like
stressor.
Good stress doesn't get rid of bad stress. Right?
No,
only the recovery.
It's true.
It's the recovery bucket analogy. And I think people need to get better at draining the bucket, the stress bucket.
Yep.
And sometimes they're just thinking of putting more stress in there and then expecting some recovery. I think sometimes that gets problematic.
Yeah, and I'll have some clients, and myself included, you know, I'm not saying that I'm perfect by any means. I'm guilty of this as well, where, you know, we have so much on our plate. It's a busy time of year right now, especially for coaches and things like that. But we're constantly wanting to de-stress, but we keep adding more and more things to our buckets. And it's kind of just trying to find that balance, because then the first question that I usually ask is, okay, what do you do to de-stress? What do you do to unwind, especially at the end of the day before bed? You know, a couple hours before bed, it's kind of necessary. And I don't say the word necessary very often, but that is one thing that I am pretty stringent upon is, you know, like, what's your wind down look like at night? And, you know, people talk about how they're on their tech devices 10 minutes before bed and things like that. And
they're sleeping with 75 degree temperatures.
Yeah, like it's warmer, you know, they're not optimizing anything. And but then they're getting like 5 hours of sleep. So first thing to go and first thing to sacrifice is sleep. And unfortunately, that's actually the worst thing that you could possibly sacrifice, because the more sleep, the more recovery that you do have, I just feel like you're just going to come into the next day so much better.
Yeah, you can hit it harder, right?
Yeah.
So like, it's just, it's more sustainable.
And even in my recovery this past year, you know, with my various, my like weird injuries, you know, from bike accident and then dislocating my kneecap, eating my car. Yeah, remember?
That was a long time ago.
It was. The biggest thing I did notice, as I hate to use the word clean, but as healthy of a diet as I possibly could in that time, and then amplify my rest, you know, try to increase the quality of my rest. Not so much maybe the duration, but just the quality of the rest that I could get. And then for me, you know, 7 hours is usually a magic number for me. But I know everyone's kind of different with that. So, but that, if you're going to go and see a practitioner, a PT, first of all, of course, do the exercises that, you know, he or she's going to assign you. They're not just assigning you these exercises just for, I don't know, S's and G's. Like, there is actually a purpose behind it. But
and ask them.
Yeah, and ask them why.
I think that's,
like Zach loves explaining, you know, why, because I always have questions, especially as a trainer, trying to look at things in a different angle, you know, as a patient, but also as a coach. So, and then optimize your recovery. Don't worry about losing strength gains during your time of recovery. 100%. You know, that honestly, at the end of the day, your strength gains are going to be very minimal. Like right now, I've been back maybe 6 weeks with heavier training and things like that. And I mean, I'm not at my PR level.
But you're not far off.
But I'm not that far off, considering what I've dealt with, you know, like abdominal injury and things like that. So at the end of the day, try not to worry about where you are and just think about where you are right now and what can you do to make that as advantageous for you going forward in terms of your recovery. You know, if you do have an injury and you are seeing PT. But yeah, do the exercise to optimize sleep and recovery and optimize nutrition as best as possible. And by that, you know, just more healthy options, things that are going to be a little bit less inflammatory You know, I mean, I hate to use the word inflammatory because sometimes that can be a little bit like hoity-toity, but you know, there are foods that obviously do kind of breed more inflammation than others. You know, French fries versus a baked potato, just to give you an example between the two. You know, so fried foods versus other things that are a little bit more less processed, and then obviously more whole foods or more natural foods.
And I can speak a little bit to that because
do it.
We just I posted something on my Facebook. It's it was a 2020 study that came out. It was a pretty big study, but they showed that knee arthritis, people had worse imaging and symptoms of the pain and decreased function of people on the diet, what they called a Western diet, which was your processed red meats, your French fries, your processed grains. And so they recommended a better diet in order to get over knee pain, knee arthritis. So if you're thinking from a rehab standpoint, again, we go back to the same thing, being resilient.
Yeah.
It really comes down to, sometimes it's not enough just to do the exercise. Sometimes you need to team up with a nutrition if you don't know how to eat well, to get them get yourself on a diet that's going to actually make that knee pain heal faster.
Yeah.
And so you keep it at bay, right? So I think that study it was kind of like a duh moment, but it was also like, well, now we have some evidence to say like nutrition plays a role in knee arthritis pain. So it was kind of cool, but it goes to show you that like we need to stop viewing it all in silos. We're trying to just make the whole system more robust and resilient.
No, it's true. It's true. Well, awesome. Well, how can people find you, Zach?
So online's great. At my website is www.truestrengthrehab.com with no E, so TRU. And then I have an Instagram. I have a Facebook. And then if you ever wanted to book a free consult, I do 20-minute consults. You can just click schedule here, and you can literally book it at any location. And I'm all across the Denver metro area.
Yeah, awesome. Well, thanks for taking time out of your day.
Yeah, thank you.
Fun.
Yeah, it was fun.
I'm sure this probably won't be the last time. We'll probably have like maybe occasional short lives here and there, just to kind of maybe show you like what dry needling looks like. I don't know.
We can do all kinds of
there's
stuff.
so much stuff. Maybe you don't want to see what that looks like.
Or
I don't know.
people could chime in and maybe tell you a little bit about what they might want to see.
Yeah, no, for sure. Yeah, if you have any questions or anything, feel free to shoot me a DM or email jen@shifthumanperformance.com. You can also reach out to Zach, obviously, with his handle, and I'll be sure to tag him and things like that. But
True Strength Perform.
Yeah.
So it's the same name.
Yeah, you'll see him. And if you check out my post too, I've tagged him in there, so you can give him a follow. He's definitely a wealth of information, especially if you're here in the Denver metro area. He's super approachable. He takes PT and makes it not so scary. All right.
Cool.
Thanks, Zach.
Thanks.
Yeah. Good job.
Cool.
Yeah. All right. Let me just end this one. Good. That was good.
Yeah, it was really good.
Yeah. Yes.
Not 28 minutes.